your portfolio?
I'm Nyankwane Kutuma Ibrahim, representing the District Director of Health Services who's on assignment in Tamale.
Okay. We have just witnessed a donation, a handing over of 10 motorbikes to your outfit by the MP for the constituency. What message do you have to direct us?
I want to first say that we are very much grateful to God. This is an opportune time. These motorbikes have come at the right time, a time when we have auctioned out all our old motorbikes and we don't even have any. And we have also scaled a lot of cheap compounds. Hence, we need motorbikes for this group of people to meet our people at the various ends there. So for this motorbike that we have just received, I think that it's a welcome idea. The MP, we are so much grateful to him for this service.
Sir, besides the motorbikes, the means of transportation, what other challenging issue confronts the health delivery services in the constituency and the district that you need urgent attention to be given?
Basically, for now, we have this challenge of upgrading our cheap compounds into health centers. So what we actually would want, I would expect the government to actually come into aid or to support us will be in the field of human resource, posting the right caliber of people into the facilities, into the district, so that we can use them to upgrade our facilities. For now, we will need a PA, that a physician assistant, into most of the areas before we can even apply for the position of health centers. Our people are actually suffering. Currently on the ground, we have the human resource that can take off a lot of activities, a lot of care in on our clients. But we are not qualified to do that because we don't have a PA. So even the drugs, many come and say we don't have drugs. Yeah, we will not have drugs because the drugs that we have, our people on the ground, given our position as a cheap compound, we cannot issue those drugs out. Hence, we don't have drugs. So we are actually pleading to the system to ensure that to help us with the human resource. And when that is done, I think that the district and the constituency as a whole will see the real position.
Sir, what message do you have for the people in the constituency and the district in the issue of health matters?
For now, we are so happy because we are moving forward. Currently on the ground, we have had at the health center there, a theater that has been put up by the assembly. We are so grateful to that. The assembly is trying as much as possible to equip. Some equipments have been brought in, and I think that the next step is to ensure that we get a doctor into the district. And at that, we have discussed with the assembly, the chief executive has taken it up and strongly fighting it out to ensure that all these group of people that I just mentioned, the PA, the doctor, and then other resources that will support this activity is ongoing. And we want to assure the community that they should be up and waiting. We are going to actually perform.
Before somebody comes to the hospital, how does the person take care of themselves before they even get sick and come to the hospital?
Can you come up again?
Before somebody will even fall sick, what education do you have for the people as a way of preventing sicknesses so that they will not even get to the hospital?
Yeah, a lot of programs are ongoing right now. That we think that if our people are able to listen to our staff that are going around, I think that this issue of always rushing to the clinic or the hospital will not come on. For one, we have a SMC, which is a malaria program going on. We are giving them the drugs, and if you take that drug, of course, it would take away all that would give you malaria parasites. Then also, we have a lot of them, I can't mention them, that are ongoing. And we think that if our communities are able to buy into this, we would all be okay, and then the hospital will be a thing of the past. We may not be rushing as we are currently rushing.
We are so much.
Yeah, thank you.
Thank you, sir.